So this is the thing that you have to understand, that the sugars and the diabetes are actually two different things. So diabetes, the real heart of diabetes is the insulin resistance, okay? So that part is what's getting worse. The sugars is really just a symptom of the insulin resistance, okay? But it's not the actual diabetes. The actual diabetes is the resistance to insulin and the subsequent very high levels of insulin. If you want to think about it, you know, in a analogy, you can think about an infection. So if you have an infection, say you have a big, you know, infection in the lungs or whatever, that's the actual disease. The symptom is the fever, okay? So what you have to do is treat the disease, which is the infection, with antibiotics. You can't treat the symptom of the fever. So if you have a very bad infection, you need antibiotics. You don't need more and more Tylenol. So diabetes is the same thing. The disease is about insulin resistance, but the symptom is the high blood sugar. And yet all our treatment is directed against the high blood sugar. So you can see that controlling the high blood sugars actually doesn't do anything for you, because you're not actually treating the disease. The disease actually continues to progress. And that's the real problem. So up to about 5 years ago, we thought that treating the sugars would make you better, right? And this is what probably all of you have heard. Your sugars are doing fine, your sugars are doing fine. So if you think that the sugars is the same thing as the diabetes, then you think that the diabetes is doing fine. But it turns out about 5 years ago that they did 3 very large studies. And what they found was that no matter if your sugars were well controlled or poorly controlled, it actually didn't make any difference. You still got complications of diabetes, you still got the disease, you know, the heart disease, the strokes, you got the, you know, the eye disease, the kidney disease, all of it. So none of that was made better by controlling the sugars. And if you think about it this way, you can see why. Because you're not actually treating the disease. You're only treating the symptoms. So just like if you take Tylenol for an infection, it might make you look better, but it doesn't actually make you better. So this is the same thing. So the diabetes is the insulin resistance. So you have to understand what is the cause of the insulin resistance, and then you actually have to treat it. So you have to treat the insulin resistance and not the sugars. Now, at a certain point when your sugars are very high, yes, you have to treat it. But that's not what is really important in the disease. The real part of the heart of the disease is the insulin resistance. And because they don't really understand what causes the insulin resistance, they can't actually treat it. So all your treatments, all the metformin, all the glyburide, all the insulin, all of that is aimed at simply treating the sugars. So here's the real question. What causes the insulin resistance? And this is what's happening in the body. This is just a cartoon. So normally the insulin causes you to lower the blood sugars. That's what it does. As you eat, you know, your blood sugars go up and insulin is released to take that sugar out of the blood and into the tissues. And that's a normal thing. When you develop insulin resistance, the insulin doesn't seem to work as well. So what happens is that the body kind of pumps up the levels of insulin to make it work well enough to get your sugars out of the way. But the high insulin level is a result of the insulin resistance. But what causes the insulin resistance in the first place? And that's really what you need to understand in order to treat it. Because if you know what causes the insulin resistance, then you can treat it. And it turns out that it's actually the insulin that causes the insulin resistance. And that might seem funny at first, but in fact, that's what happens in most biological systems. So if you look at any other hormone, if you get exposed to it, your body develops resistance to it. So if you look at addictive drugs or alcohol or anything, or smoking or anything, as you take the first one, say for instance marijuana or cocaine or one of these addictive drugs, or you can take Valium or any of these anti-psychotics and stuff. As you take the first one, you get a real high, but every subsequent one is a little bit lower. So you wind up having to take higher and higher doses to get the same effect. And that's really resistance or tolerance, and it happens for all drugs. Insulin is exactly the same. As you take more and more insulin, your body develops more and more resistance to it. And now you see that it's actually a real vicious cycle, because what happens is that if your insulin level is high, then you get some insulin resistance. As you get insulin resistance, you get higher insulin levels. As you get higher insulin levels, you get higher resistance, and it goes round and round. So you have a vicious circle. And in fact, treatment with insulin now is not simply not effective. It's actually making things worse because you're feeding into that cycle. So while the insulin lowers your sugars, it is actually raising your insulin resistance. So in fact, it's making things worse. You're getting more diabetes by taking the insulin. And that's the real problem. When you understand the actual disease, you can see why current standard treatment is actually not only not effective, it's actually really, really, really bad for you. Because you're treating the exact, what is actually causing the disease is what you're treating it with. That's never going to work, right? It's just not going to work. So if you think about it, the problem is that the insulin level is too high. So you're not going to make things better by taking more insulin. It's like treating an alcoholic with alcohol, right? This is exactly the same thing. So the same thing happens in alcohol. If you take alcohol, the first one you get, a real buzz, and then every subsequent one is a little lower. And what happens is that if you take the alcohol, you feel a little bit better. But you're not making the alcoholism any better, right? This is the exact same thing. The problem is that your insulin levels are too high. So how can taking more insulin possibly be good for you? And the truth is that it wasn't. It was never good for you.